Hello, and welcome everyone to the first Focus Cities webinar of 2018. My name is Tracy McMillan, and I am your moderator today. I'm part of the SafeTREC team at the University of California, Berkeley. For those not familiar with SafeTREC, which stands for Safe Transportation Research and Education Center, we are a University of California, Berkeley research center affiliated with the Institute of Transportation Studies and the School of Public Health. Our mission is to reduce transportation-related injuries and fatalities through research, education, outreach, and community service. SafeTREC conducts research, provides technical assistance and workshops to communities across California, educates the transportation safety professionals of tomorrow, and coordinates major transportation safety programs for the state of California. Before we dive in, a couple of reminders. Please be sure to mute your audio, and also know that we will be recording both the webinar's audio and chat features, and we will make that recording available afterwards. If you do not want to be recorded, please refrain from talking or using the chat feature. At various times during the presentation, we'll open the floor for comments and questions. You can type your questions in the chat box on your screen, or raise your hand using this function in Zoom, and we will unmute your audio so that you can verbally ask your question during our Q&A sections. So let's get started. I'm excited to introduce today's presenter, Kate Beck. Kate is a graduate researcher with SafeTREC at the University of California, Berkeley, where she will graduate in May with a master's in city planning and a master's in public health. Kate looks at transportation through the multiple lenses of safety, mobility, health, and equity. She will be talking to us today about the demographic disparities in transportation safety data and decision-making, and new methods and tools such as Street Story to improve current practice. Kate, take it away.
Hi there. So I'm on a different computer than Tracy, so if there are any technical difficulties, just send in a response in the chat and we will try to address those. So today I'm going to be presenting on addressing demographic disparities in transportation safety data, and I'm also going to be introducing SafeTREC's new project called Street Story that we're working on in partnership with the California Office of Traffic Safety. So the presentation will be about 30 minutes long, and we'll have time for question and answers and discussions. So if you have any questions, just put it in a chat or put in your response into the chat box, and we'll address those throughout the presentation. We also have a couple of question sections throughout the presentation where we'll be looking for your feedback. I'm going to go into less detail in this presentation, and then we're going to send out a resource document with more information. And if you'd like to ask me about more resources or further research that is part of this presentation, just send me an email or send us a message in the chat box. So today, I'm first going to go over the demographic disparities in transportation collisions, which I think a lot of you are probably pretty familiar with, but I'm going to go over that quickly. Then looking at inequalities in decision-making processes around allocating transportation safety resources. And then I'm going to go through police-reported medical care data and then self-reported data. And then I'm going to introduce the Street Story platform that we're developing, and then go over next steps and providing you with some resources for how you can address demographic disparities in the work that you do. So the problem that the transportation field is needing to address, and that we're focusing on in this presentation, is that low-income groups, people with disabilities, seniors, racial minorities, and rural communities are at higher risks of, or at a higher risk of being injured or killed when traveling, but information on the safety needs of these groups is limited. So this is the demographic data that I'm sure most of you are pretty familiar with, but pedestrian death rates in census tracts with poverty rates higher than 30% are have higher rates of pedestrian fatalities. Then seniors are also at a disproportionately higher risk of being in pedestrian collisions that then lead to a fatality compared to the population that isn't 65 years or older. And this is true across the board, across the country, but specifically in California, the death rates of seniors are quite high. Then there's also demographic disparities in people of color and pedestrian death rates. So Native Americans, African Americans, and Latino individuals are at a much higher rate of pedestrian deaths compared to their proportion of the US population. This is true in California and across the US. Then in rural communities, their per vehicle miles traveled, there are also higher transportation-related fatalities. So as I'm sure all of you are familiar with, there are more pedestrian bicycle trips made in most urban areas, so there are more pedestrian bicycle fatalities in urban areas, but when we're looking at transportation-related in fatalities and injuries as a whole, rural areas have much higher rates based on VMT. So these disparities are really important for addressing transportation safety in the state of California, but also in local jurisdictions. But one of the issues is that these groups are underrepresented in police report data, which I'm going to go into in a little bit more detail in a couple minutes. So as most of you are aware, the transportation field is moving towards making data-driven decisions in terms of allocating safety resources more effectively and also more equitably. So if we can use data to back up our decisions to make safety changes, then hopefully we can reduce the disparities that we saw in the last few slides. And the main data source that agencies, community groups, advocacy organizations use is police reported data. However, if specific groups don't feel comfortable reporting to police, or if police are less likely to go to a location of a collision in specific neighborhoods, then there's going to be fewer police reported collisions in those areas, which may lead to fewer resources being allocated to these neighborhoods. The field is also moving towards community-driven decision-making. So community engagement is becoming a prerequisite in receiving safety improvements in some communities, although it's important to be clear that there's still a lot of work that can be done in this area in terms of making this a prerequisite. But in current community engagement processes, like request-based safety improvement systems or public meetings and surveys are inequitable in terms of the people who choose and can participate in these types of processes. And if you'd like more information on this, please let me know by email or in the chat box, and I can send that out. So the overall problem that we are focusing on is that the information that we do use is limited in some way, and then that may lead to issues in terms of how safety resources are allocated. So as I've said a couple minutes ago, and as you are all familiar with, police reported data is what is mainly being used. So I think most of you are familiar with these systems, but I'll just go through them quickly. SWTRS is the police reported statewide database. It's made publicly available through TIMS, which is a program that we run here at SafeTREC. Then FARS is a federal database, and then some local jurisdictions also have local police reported databases. There are a number of shortcomings in police reported data, specifically demographic disparities in terms of who reports collisions to police. So pedestrians and bicyclists who are in collisions are found to be less likely to report collisions to police officers compared to people who are in vehicle-on-vehicle collisions. And then research has also found that people of color or community groups that have a historically tense relationship with police officers are also less likely to report issues to the police. And then there's also issues in terms of police reporting in police reported data in rural communities or tribal areas that may not have police departments that will be attending to the collision. Then there's also issues in terms of if there are fewer pedestrian or bicycle trips in an area, then there is less likely to be a collision there, which can mean that these areas are underreported or are underrepresented in the data, even though there may be significant safety issues. Then minor collisions and near misses are also not reported in police data. And the lag time in terms of accessing police data is quite significant. So as most of you are probably familiar with, it's difficult to gain access to police data from anything longer or earlier than, more recent than about 2 years ago. So police reported data that takes a while to anonymize and process, and this can mean that people who are trying to improve transportation safety are working with data that is 2 to 4 years old. And this can be a pretty significant area or issue in areas that are changing quite quickly, and to data that is older than 2 years just may not be relevant any longer. Or this is also an issue for areas where a new safety improvement has been put in and then needs to be evaluated. Waiting that 2 years or 2 to 4 years can be an issue. And then finally, police may not be trained to determine injury severity. So when police attend to a collision, they are basing that report off of what they see at the site of the collision. So this may mean that the injuries that they're reporting are not accurate. So just to focus specifically on demographic disparities in police reported data, which is the topic of this presentation, there's a lot of research out there to support these to support this claim that there are demographic disparities, but I'm going to focus on one paper or one research study that was done in San Francisco. If you'd like more information, just let me know through email or put a comment in the chat box. So a study done in San Francisco in the early 2000s found that police reported data underestimated the number of injured pedestrians by 21%. And this was compared to hospital data, which I'll go into in a minute. They also found that Black patients in the hospital were 45% less likely to have a police report of the collision compared to white patients. So here's a question for all of you. What are some shortcomings that you've experienced in using police report data? So you can put your answer or comment into the chat box and we'll address them.
People can also raise their hand, if you pull up the participant box, there is a button that shows that says raise hand to indicate you want to ask a question verbally, and we can unmute you to ask that question.
Okay, well, we have no comments, so I'll move on. So as I just covered, the goal is to prevent crashes from occurring in the future, and the information that we're using to do that is looking at historical police reported data most frequently. There are some groups and jurisdictions that are using other forms of data, which I'm going to talk about now. So there are these alternative forms of data that we can use to complement police reported data and hopefully attempt to prevent those future crashes from occurring. So that is police reported crashes and self-reported crashes. There are some other data sources available, but these are the two that I'm going to be focusing on in the presentation. Another option of the types of data that we can use to address or to prevent crashes from occurring in the future is looking at perceptions of transportation issues and also near misses that are occurring. So this is a more proactive way of trying to address these collisions from occurring. So instead of waiting for a crash to occur before addressing that area, we can get more information from constituents about where they think transportation safety issues are and that sort of thing. And a lot of this work is being done in through doing walking and biking audits and surveys, and I'll address all of those in a couple minutes. So looking at hospital data, there's a number of different forms of hospital data. There's emergency room data, hospitalization data, and 911 call data. This information is pretty hard to get a hold of, but your public agency can, or your public health agency for your county can provide this information, provide emergency room and hospitalization data aggregated at the zip code of the patient address. So that can be useful in some cases, but there's also some jurisdictions that are focusing on accessing this data to be more useful in terms of actually addressing transportation safety issues. So I've talked about this a little bit, but there's some advantages and disadvantages of using hospital data. So research has found that there's increased reporting of severe injury collisions when using when using hospital data. And then there's also improved accuracy in the kind of injury, in reporting injury severity when using this data. In terms of disadvantages, the location of the collision may not be accurate because the medical professionals filling out the report are basing this off of secondhand information. It may also be difficult to attain disaggregate data, which is most useful in our field. And then it's also very resource intensive to obtain and manage hospital data. And then there's significant privacy considerations that need to be made. So the other alternative data source is looking at self-reported data. So this is when individuals report collisions, near misses, or other safety issues directly to city agencies or to an advocacy organization or a community group that is attempting to address safety issues in their area. There's a couple of different, or a few different ways that city agencies or community groups or advocacy organizations can use self-reported or access self-reported data. So there are some existing data sources. 311 is one option that I think is underutilized in the transportation world. So a lot of municipalities have 311 reports. as an open data source, and you can filter to only look at 311 reports that relate to transportation related issues, and the location of the report is quite good. So I'll give you a quick example about how we've used that here at SafeTREC. So here is Oakland. This is just a quick slide showing police reported issues, or police reported pedestrian bike collisions in Oakland in 2015. So there are 505 collisions and 475 that were able to be mapped based on their location information. And then when we look at 311 reports related to transportation issues in Oakland, we had 10,000 reports. And again, this was all publicly accessible information and really easy to use. So when we get these 311 reports, we can actually start looking at the number of reports per capita and where these reports are being made. We can start to look at the types of reports that are being made, and hopefully use this information to proactively address safety issues. Another option for self-reported data is collecting the data yourself on a small scale. So this is done already in terms of community mapping and paper surveys and that sort of thing. It's being done more and more using web platforms or mobile smartphones. So this is being done, this is being done by community organizations, advocacies, agencies. And here's an example of a self-reported small scale online survey that we did at earlier this year, or 2017, I guess. So it was quite small scale. We did outreach through SafeTREC social media accounts and through some listservs, and we received 289 reports of where people have gotten into collisions, where they'd gotten into near misses, or where they generally felt unsafe while walking or biking. So again, if we can use this data to complement police report data, we can get a little bit of a better picture about where these safety issues are. Then there's also large-scale data collection of self-reported data. This is being done by government agencies as well as by private companies. So private companies are developing web platforms or apps that where they encourage people to report these kinds of safety issues themselves, and then they'll partner with government agencies to make sure that this data is useful in terms of addressing transportation safety issues. And then there's also a number of government agencies that are also using platforms and developing apps where people can report this kind of information. So the City of New York has developed a Vision Zero community mapping platform. The Oregon Department of Transportation has also developed a similar platform. And this is a really good time to tell you a little bit about California Office of Traffic Safety and SafeTREC's Project Street Story, which will be a platform for self-reporting collisions, near misses, and general safety issues in California. So the idea is that members of the public can report issues that they've had. Then this information can be downloaded by agencies, advocates, community groups, or members, individual members of the public. And then this information can be used either to complement police report data when applying for grants and that sort of thing. It can also be used as a community engagement technique, or it can also be used as an evaluation strategy. There are a couple of advantages to using self-reported data. It removes some of the barriers in participating in reporting collisions or participating in community engagement processes that we had talked about earlier. You can also capture information that's not provided in police-reported data. So here's an screenshot of a 311 report made in Oakland. So we get pretty detailed location information. We get categories of how this report pertains to. And then we also get a photo and then a pretty detailed description about the kind of issue. And in the Street Story app or platform that we're developing, we're ensuring that there's multiple ways of reporting, and so we can capture similar levels of information that can be useful for city agencies or advocates to make these safety improvements. There are also some disadvantages in using self-reported data. Some of the barriers to participation are reduced, but there are also new barriers to participation. So access to technology like smartphones or Wi-Fi is an issue. And then there's also some groups, individuals who choose not to use these kinds of technologies or don't feel comfortable on them. So that's one issue to using a self-reporting data platform. There's also issues in terms of who trusts that the report that they're making is actually going to be addressed by a city agency, and trust that the system is going to work in their favor. So that's something that we're currently working on addressing in the Street Story platform. And if you have any other ideas about, or if you have any ideas or want to talk about this more, I'm really interested in thinking through this problem. Another issue is that this self-reported data introduces some recall bias and subjectivity in the kinds of reports that are being made, and how they're reporting. So this is another issue that we've thought a lot about in developing this Street Story platform, and I think there are some techniques that can be used to address this issue, but if you'd like to talk about this with me further, I'm also very interested. So here, I won't go into these in detail, but here are some resources for you in terms of collecting self-reported data. This is also going to be in the resource document that I send along. And are there any other ideas that you guys have for accessing self-reported data? If there are, just put them into the chat box. All right, I will move on to the next slide. So the solution is that we can find other data sources that can complement police-reported data to better encompass the needs of underrepresented groups. And then finally, we'd like to ask if there is anyone who's interested in participating with the Street Story app. So we're currently looking at piloting the platform and working with agencies, advocacy organizations, or community groups in any of the focus cities. And then the platform will be widely available in late 2018. So you can either send me an email if you're interested, or you can respond in the chat box to us. And the link for more information on this is below.
Kate, we have had a couple of questions that have come in. One question from Emmett Berker is, the platform that you mentioned, Street Story, will it be Google Forms based, or and will it be public, or is it proprietary?
It'll be a private resource, or sorry, it'll be a publicly available resource that any jurisdiction or advocacy group or community group can use in the state of California. It won't be a Google form. We're working with GIS Esri, so it'll align with how the TIMS platform is developed. And if you'd like more information on this, we can talk offline. And let me know if there's more information that you think the group should know, and you can just put that into the chat box.
Okay, great. Thanks, Kate. Another question that Maybette has is whether you've heard anything from the City of LA staff about joining the Street Story project.
I have not heard anything from the City of LA, but if they are willing to participate, please send me an email.
Okay, great. Thank you, Maybette, for your questions. Does anyone else have any questions that they would, or comments that they would like to share with the webinar participants? All right, Daniel is asking, any chance of the data being made available, for example, the crash stats? Everything that's been presented in the webinar today via the slide share and the audio that we've been recording intermittently, but fully, will be shared with webinar participants after the webinar is completed. So just give us a little time shortly thereafter and we will share all that data. Okay, we have a comment from Chris Johnson from Walk San Diego. It seems like you're aggregating a number of different sources that have pretty wildly different levels of reporting bias. How are you matrixing, weighting the various sources to make sure you're arriving at informed, equitable snapshots and priorities, if that's even the goal?
Thank you, Chris, for your comment. That's something that we've thought a lot about, is how to weight these different types of data and make sure that they're representative of the groups that are participating, and that we're trying to limit reporting bias and all of those kinds of things. We also want to make sure that we have resources available for community groups, agencies, or advocacy organizations that they can use when using street story data and pairing that with police reported data and other types of data. And if you have any information for us on that, or if you want to talk about that kind of thing further, please contact me.
Thank you everyone for your questions today and your comments. And we would love to continue this dialogue regarding demographic disparities, self-reported data, and other data sources that are available to inform data-driven decision-making around transportation safety. Since it seems like our questions have wrapped up, we will go ahead and close things out. I would like to thank Kate Beck for her time today and sharing this great information with everyone. Again, the Street Story project is looking for pilot sites to participate as they move forward with the project and work on refining the tools that will be very useful for community groups and municipal agencies and other governmental agencies to enrich the data sets that we have on transportation safety. So San Diego has already expressed their interest. We will contact you, and please contact us. And we thank everyone for your time today. Have a wonderful day, and thank you for sharing a part of your day with us to learn about these innovations in transportation safety. Thanks so much.